Hello and a very warm welcome to you. It's my pleasure to welcome you to another edition of Editors Forum. I am Rita Omodia. And of course, on this program, we get to discuss front burners, headlines, big issues that occurred during the week. Of course, I'm not alone on today's edition of the program. I have with me Tony Onwaje and Olusegun Ario, both of them public affairs analysts and journalists. Thank you very much for joining us on the show.
Much, Rita. Thank you.
How are you coping with the lockdown so far?
It's not been easy.
It's not been easy, but you're managing,
it's
right?
okay. It's good
you just
for us.
have to.
Yeah, it's good for the
stay
country.
safe.
It's good for the world. Yeah.
All right, thank you very much. Of course, within the week, we know that on Sunday was Easter Sunday. It wasn't usually the normal Easter Sunday we would have due to the lockdown that we had in Nigeria. We also know that President Muhammadu Buhari on Monday extended the lockdown by another 2 weeks. So far, so good. We have about 493 cases as at yesterday, 10:10 p.m. Yes. And if we look at it drastically, right from the first case we had on the 27th of February till now, we would know that the cases are sporadically increasing. Just as in 15th of April, that was on Wednesday, we had 31 new cases, and just yesterday we had 51 new cases at a stretch. Of course, we will see credence to that due to the fact that the testing has been increased. We know that the Lagos State government talked about house-to-house testing to try and identify those with confirmed cases. And of course, we use the opportunity on this show to once again reiterate the need to stay safe during this period. Coronavirus is real. Your safety, your health must come first. Do follow all the safety guidelines of the NCDC, that's Nigeria Center for Disease Control, the WHO, World Health Organization. Follow credible news stations, log on to Galaxy Television. Of course, we'll keep you updated about all happenings on COVID-19 and ways to stay healthy to keep yourself safe from COVID-19. As I said earlier on, the cases are rising. We have about 493 cases now confirmed. We have 17 deaths and we have about 51 discharged. Of course, that is a very good one for Nigeria there, but as we're having more people being discharged, we're also having more cases arising. And talking about death now, it's quite on a sad note that at this point we mourn all those who have lost their lives due to coronavirus. We know that we have about 17 deaths now. They said one death is not too small. As far as someone is dying, then there is a big problem. And due to coronavirus in Nigeria, we've had 17 death cases. And of course, bringing our attention down to those at the top, we also know that President Muhammadu Buhari's Chief of Staff, ABBA KYARI'S, also died due to coronavirus. We had the news last night, and of course the station and of course Nigeria, everyone is mourning, and we sympathize with all those who have lost their lives due to coronavirus. We also know of health doctors who have put their lives on the risk due to coronavirus. We know a health doctor, which was Edwin Chubo, who died due to coronavirus. So we see a lot of people putting their lives on the line for coronavirus. So it is therefore important that you keep yourself safe to prevent the spread of coronavirus. Follow whatever instructions have been given to you. Of course, this week has been a long one there. Let's take a rundown of big stories that happened during the week, and we'll be right back for discussions.
lóúnjẹ àní kánsẹ́lọ̀ wọ́n pé oúnjẹ káàkiri wọn ò pín dẹ́kọ̀ sọ̀fẹ́ bíbà wọ́n dà pé wọ́n ti fún wa lóúnjẹ wọn ò dẹ̀ fún wa ní nǹkan kan.
Now we just sit down like this wetin we wan chop say mo come dey kill ourselves abi mo go dey thief.
And they say we should stay at home. They don't want crowd. If you reach our local government, the crowd over there is almost 1,000 plus, and they say they don't want crowd. This is the 3rd week now we've been staying at home, and another 1.5 week is even coming. We have not even seen anything. No food, no money. Ebi power oh,
Of course, the watchword there is stay safe. Globally, we have cases of more than 2.5 million people who have been confirmed with coronavirus. Global deaths, we have at least 154,219. Of course, this is data from Johns Hopkins University in Nigeria. As I said earlier on, we have 493 confirmed cases. We also have 159 discharged, and we have 17 deaths. As I said earlier on, we also have the Chief of Staff to President Muhammadu Buhari, ABBA, KYARI, dying due to coronavirus, and we also know doctors who have died due to coronavirus. May the souls and the souls of all the faithful departed rest in perfect peace. Of course, now let's come to issues here affecting us, and we will still start with the death of the Chief of Staff, ABBA KYARI, versus health security. Now, from the reports that we also got here, we know that the Chief of Staff died due to complications of coronavirus, and we also know that a Nigerian doctor died of coronavirus after treating an infected patient in Lagos. Now, we have it there that a Nigerian doctor in private practice Wednesday morning died of coronavirus-related complications after treating an infected patient in his hospital. The doctor, identified as Dr. Chubu Emeka, who died at the Lagos University Teaching Hospital, Luth, was said to have been admitted in the hospital Monday after contracting the disease from a COVID-19 patient he was said to have managed in the private hospital where he worked before his death. We also have news of some hospitals now who have been quarantined due to the fact that they have had confirmed cases. Of course, I will use this opportunity to also say that it is the responsibility of everyone to stay safe. When you know you're showing symptoms of coughing, sneezing, please do self-isolate and call the designated numbers of the NCDC. Please keep yourself safe and keep others safe. And this is bringing us to real health concerns. Now, we know that health personnel from time to time have been talking about safety kits, health workers being on the line, people dying, and now we're having allegations of private hospitals secretly treating coronavirus patients. Now, this will cause a big adverse effect on people, because when you have you treating secretly coronavirus patients, the risk of other people in that hospital are also at risk. So I'll start with you, Olusegun. What is your own take on this? Of course, and relating it with our Chief of Staff's death, ABBA KYARI.
Yes, the issue of private hospital handling coronavirus. First of all, what's it called, the coordinator for this presidential task force on coronavirus, he told the general public to warn general public of, especially those that are into private practice.
Yeah.
It is not because of anything but the dangerous aspect of that approach.
All right, you're welcome back. You're still on to Editors Forum, exclusive to Galaxy Television. We do apologize for that audio glitch there. And now we're talking about the health security concerns and raising concerns about hospitals allegedly treating COVID-19 patients secretly and the dangers that this would pose on the country, Nigeria. Shegun, you were saying something.
Yes,
there.
I was saying that, yes, indeed, the proactive step government had taken, the presidential task force on this COVID-19 is excellent, because the virus is beyond private hospital. What we see is, internationally dominated, something that has become a pandemic, and even those advanced countries that knows that this thing originated from hard issues. So coming to our local level to say that we should begin to have a private hospital to handle them must follow accreditation, as the Minister of Health has posed it, that any private hospital that wants to do anything that's to do with coronavirus management must get accreditation from government. The thing is not something that one can remember. What's it called, Dr. Adadevo?
Yeah.
That the man that came from Sierra Leone the other time, it was a private hospital handled it, and we saw the way that woman went for it, and it's dangerous. Sincerely, so I agree with the presidential task force and the minister specifically asking that every private sector should desist from handling any COVID patient, and rather they should refer them to NCDC, and it's excellent in that form. I think I appreciate what they are doing.
Okay, thank you very much, Shegun. Against the fact of private hospitals allegedly, because we're hearing reports that they're allegedly treating people with coronavirus disease. We also know some people who know that they have disease and they're just keeping it within themselves, and this is also posing a serious threat on the country. Tony Nwaji, let's hear from you.
Yes, so let me start with the death of the Chief of Staff to the President. I feel so sad, that he has to go this way. I prayed that he survived this, because it would have been a turnaround in our health sector. For the first time, majority of them are now looking for how to be cured within the confines of the country. They were trapped. Nobody could travel anymore. That's why it happened here in Lagos. I prayed. I wished he lived. But I want to believe that Nigeria as a country is taking a lesson from this. That at the end of the day, we should do what we're supposed to do. Right now, the world is closed. Everybody is closing their country, so you can't even take anybody out. So you have to use what you have here. Whatever you have here, no matter how you put it, is how you're going to use it. So, and because I know it's going to be over soon, definitely by God's grace, we'll come over this and we'll live to tell the story. So that at the end of this whole crisis, we can then sit down and say, okay, we made a mistake here. We need to correct it. Our health sector has deteriorated for a long time, turned into something else. And with the chief of staff to the president yes. going into it like this, it's not something funny. That said, I pray for his soul, and I wish him may his soul rest in peace. Moving on, I think we need to do more. We need to get serious. Nigeria needs to. I drove all the way down here. All the police checkpoints are not, they have disappeared. And I told myself I'm going to talk about it. They have disappeared. I went out on Tuesday last week to a media station too. They were on ground. But today, I heard it about 2 days ago, but I needed to experience it today myself. Okay. From the way Lagos is, I can drive from here to Ekpe and nothing. And it shouldn't be. There's hunger in the land. People are hungry. But then, for me, I prefer safety over hunger.
Of course, we'll still come to security concerns, but now we're still dealing with the health security that's affecting the nation now with supposed private hospitals.
Okay, on the private hospital, yes. On the private hospital, it's everywhere. The issue is this: we are talking about, because every attention is centered here in Lagos. Take Lagos out of it. And look at the rest of the country. Most of these private health facilities. They are doing it. In fact, some Nigerians do not even disclose. So, some of these facilities, this hospital, they don't even know that, because they're not going to tell them your history, your travel history, and all that. And most times they've gone far in their treatment. That's the
Before
case.
they realize that.
Before then, everything has gone haywire. So that is where the Ministry of Health needs to come into this. How do you, how do you get all the because, okay, now, just as I said before, we've gotten to that point now where we start asking ourselves, how did they get it wrong at this point? Because it's now late. How do you galvanize or get all the, we have mushroom hospitals everywhere in Nigeria.
So how do you know, how do you get all the hospitals?
How do you get them together and say, okay, this is how, there must be a template. There must be a guideline on how you admit patients at this point. How do you start educating the health workers at that lower level? Most of them don't even know. You have people who their only job is to give injection. They know nothing. They can't even speak English. How do you bring them together at this point? This is a critical level, and it got into that emergency, end. So I don't think I'm going to do it. They only talk. Okay, now we know this is what's going on. So what is the Ministry of Health doing? What is National Center for Disease Control doing at this point to turn it around to make sure we don't go on that route? Because as we speak, it's still happening. Majority of Nigerians won't go there. I watched a video on Monday where a lady in Benue State was saying she's been locked up, transferred from Benue State, from Makurdi to Abuja. And she has spent over 25 days right now, I think because it was over 25 days now. She hasn't taken any drug. It's okay. It's like she was locked up, and all that, And then most times you hear the stories of our isolation centers. It's only in Lagos here, maybe in Abuja, and few of them. When you see isolation centers outside, and we are politicizing it, that's my fear. We are politicizing it.
And so people are even afraid to go to
people are afraid. So they would rather go to those small hospitals. Some will even hide in the house and do those local treatment. I've heard many, different kind of remedy to sort this. That has not been proven. But that is what is happening. So my fear, if following what the WHO said 2 days ago, that Africa seems to be their next epicenter. We're not getting it right yet. It's not about having a daily briefing on TV and tell, what are you doing? People need to see. I'm not seeing them, except maybe I come on TV and see them do 30 minutes briefing and then we go home. What are you doing to reach out to these hospitals? And how are you doing it to get this thing, to turn it around?
Because you can't close the hospitals.
You can't close it, but you have to reach out to them. To say, this is how you treat. You must be suspicious of people coming into the hospital and say, because at this level, you then not go to the hospital and claim malaria. So a doctor who is discerning will be able to read in between the line and say, okay, at this point, I think I need to contact the NCDC. How many of them know where NCDC is located within the states? Do we have it in our local government? Is it at the state capital only? What about the nitty-gritties of the locals? So I don't see us getting it.
Let me say something here. I'm a bit. I'll be divert from a submission regarding what he said that they have not been meeting up to a standard. Let me say this: Lagos State.
I said take Lagos out of it. Okay. I always give Lagos the credit. Take Lagos out of the rest.
They have been, making sure that every areas of concern.
Don't say Lagos is good. I did not indict Lagos in any way.
Okay. Let me add to what you have said. I'm still going to talk about the federal aspect you just mentioned, because I said earlier that the minister said that henceforth no private hospital should do anything.
He said.
Yes, and that they must follow accreditation. And he went further to direct all those centers to ensure in all the states that every state who's having, a case of
through a circular or just by own?
Through their periodic press briefing. They said that, and hold on.
It's not through briefing. You're getting it wrong.
Let me learn.
What is briefing?
Now, what I discovered from Lagos is that they came to my location yesterday because of security. I will not want to mention my location. They told everybody there that even if you get to any local hospital within Lagos
Lagos is good.
That you can, the doctor would immediately, as directed by the federal minister, to get NCDC's contact and package you in that form, then allow them to come and pick you from there, then straight to isolation center. I think that network is efficient.
Can you say that about
that's after? Is it after you have confirmed that the person has? Because how would you know the person has it? The private hospitals don't have the testing kit.
Yes, that is the reason why they said once you see any symptom as a doctor, You just hold it, you call the NCDC center. The NCDC center would immediately come to that location, pick up that patient straight to isolation center for further, administration of whatever they want to administer on that person. So I think that idea for me is still a welcome development.
Okay.
We are not like the advanced country. We are African, and Nigeria, yes, I agree with what he said, that the World Health has said that in no distance time here will be the epicenter and all that, but that is what they are saying. But I can assure you, from what I'm seeing in Lagos, I'm not a PRO for Lagos State, but what I'm seeing in Lagos, I have seen.
We have 36 states.
Okay, let us analyze it from where those breaking news is showing.
People are making interstate travel every night.
Those COVID cases. Yesterday we have 51 new cases. The eyes is from Lagos. Are you following it? Yesterday we have 51
new. Of course, you know the reason why they're in Lagos.
Lagos should be in the way it is. No excuse. Lagos should not give excuse. What we just need from a federal government is to give them what they need financially.
I think if I want to comment with what Tony is saying, he's saying Lagos is doing well, but we shouldn't find Lagos right now has the highest number of cases, but we shouldn't just single out Lagos, because the NCDC DG also said that at this point it's possible that COVID-19 cases will spread to all the states in Nigeria. So that means it's not just for one state to take precautionary measures. Also, because people have actually also traveled to other states. We have cases coming up. Right now we have 19, we have 19 states with confirmed cases of coronavirus and the FCT. So if other states are not taking precautionary measures, it's going to keep on spreading. Are you not, okay, can we talk about FCT Look at Kano and Kaduna, where we also have population that increase. Can we evaluate FCT now? Have you been following what, that's the epicenter, that's the center of excellence, that's the FCT federal capital. You can see the way they've been following. In fact, their level of security management there is even more. Although they are, I was bit, away from their too much of action on the people. Because Adeburu has said in a press statement that the president must follow the law. Although I don't want us to go to that level now until the discussion comes. But let us look at Abuja from levels of management. They are trying, and the prominent areas we are talking about where these things are coming on is Abuja, Lagos, and all areas that has international flights. Where is this thing coming from? Is it from Nigeria? It's coming from outside country. So the president, he knows what he's doing. Initially when he gave, he handed down a lockdown, he has put into consideration where there's much of concentration in terms of population, where international flight comes from origin to destination. But the international flights are coming into Lagos. In Lagos, and they're going to other states. The reason why it must be done in Lagos, Abuja, because that is where the destination of many of those international flights are coming.
We are past that stage now. Yes. The NCDC, according to NCDC, now what we are experiencing is community transmission. We have shut down airports over 2 weeks now. Except maybe skeletal services and all that. So now it's within the communities. Now we have cases in Kano, I think Kano or Katsina, that trailer loads of people outside Lagos in the night. It happens. People travel from here, they do interstate travel and all that. So it tells you that we still have a lot. And what we are battling with right now is no longer about people coming into the country, foreign or Nigerians traveling up or in and out of the country. We are talking about community transmission. Now when you say community, now it permeates from the states, local government to villages, communities and all that. People now move around and you don't know their history. The initial stage, when it started, we said, I think there was this aircraft they were looking for, about 4,000, trying to locate passengers who were on board of that aircraft. I'm not hearing anything about that. And these people, they mingled, they mixed with this.
Well, according to the president of the federal government, when he made his speech, he said about 91% of contact tracing.
I've been able to.
Yeah,
contact tracing.
That's what he said.
Okay, that's what they said. Now, they said it's community transmission. So now, these hospitals, I know what I'm saying, even in Lagos here, there are some hospitals, when you see them, you'll be scared that this is called an hospital. Then take Lagos out of it. Go to
in the outskirts, the boundary areas.
So some of them, as I said before, these are just dispensing clinics. They have nothing, and these are places where people go to seek help. They don't want to. They see isolation as being under detention. Government is not. I mean, as I said before, just for me, it's only I've not seen any other thing except Lagos. Every other thing they are doing is just show for me. It's not about putting up isolation centers. I was looking at one. Yes, I critically and like I know. Listen, you see beds. That's all you see. You just see beds, decorated beds
inside the beds,
and they tell you this isolation center. And all. It goes beyond that. What about the human resource that will manage it? What is the training like? I mean, what's the security like? What about the electricity? What about the comfort? You don't put people. I saw a video where we just seated as if I mean, that is we need to watch international media and see what is going on in other countries. That is not so. I'm not going to sound politically correct for anybody. We are at that critical level where we should tell ourselves the truth. If coronavirus and claim the chief of staff to the president, then we shouldn't be joking about it. The truth needs to be told. Otherwise, all of us will see ourselves at the chopping board.
Okay, let me quickly chip something here.
Quickly.
First of all, I agree with him about the chief of staff. You know that, but the truth of the matter is that if this thing is not international, the chief of staff would have traveled outside the country. Yes. Are you getting my point? So I condone with the deceased. May God rest his soul. But the fact of the matter is that we agree it is uniform, whether you are rich or poor. So that is exactly the reason why. In fact, if you observe, you know, I have been going everywhere, many locations that he's talking about. I have seen the touches of Lagos State and federal government in many hospitals because of this COVID-19. Are you getting my point? Which, if ordinarily we are talking about bringing money into health sector, they will turn their deaf ears. So all these things we can say is a blessing. Now, come to community transmission that I was talking about. The approach, the methodical approach that the minister had pronounced.
Which minister is that?
The minister.
Methodical approach.
Doctor, hold on now.
Is having issues with NFA?
You must have accreditation. For heaven's sake, if you go to, there's a directive to all these health sectors in primary health care in Lagos now. If there's any suspected case or anybody brings himself in to be talking about pains and all that, there is a direct line
that you can
call. So that methodical approach is a good one. You can't expect the government to have isolation center everywhere. They don't have money. Do you know what Nigerian Post is talking about?
Let's pause there now.
They don't have money.
They don't have the money.
Thank you very much. Talking about the alarming health security that, of course, COVID-19 has brought.
Let them be hiding.
People are seeing a lot of health deficit that we're having in the country. But of course, looking at the economic palliatives now, we know that right from time when President Muhammadu Buhari talked about the lockdown, people were complaining about hunger. Those who earn their money through daily work, for example, lots of people earn their money through daily works, as they work in the day just during that day and they get money from it, and they're like, if you have a lockdown, people are going to get hungry. Now, the first batch of the lockdown, when President Muhammadu Buhari said 2 weeks at first, people complained, and then President Muhammadu Buhari again extended the lockdown due to the rising number of cases. We can see that the cases are increasing drastically, and he extended the lockdown, and people complained, once again, we're going to get hungry. Luckily enough, now the Minister for Humanitarian Affairs and Disaster Management, Sadiya Farouk, declared that her ministry will focus on the urban poor, national social register, as well as bank verification number to determine who benefits from the distribution of palliatives to cushion the biting effect of COVID-19 on Nigerians. Of course, she also stated that, let me quote what she said. She said, well, we have 3 options. We are going to use the National Social Register that we already have. 2, we are also going to focus on the urban poor by using their verified BVN account to get them. That is, people that have an account balance of 5,000 naira and below. We also know that the EU donated 21 billion naira to support Nigeria in the COVID-19 pandemic. I'll start with you, Tony Nwaji. Do you see this as a welcome development? We have been clamoring right from time. Let's just say that. Can we say that our voices have really been heard, or do you still see loopholes in saying, okay, those below 5,000 naira should not get the benefit?
See, Rachel, no problem. Good. I commend them. At least let Nigerians even enjoy their government for the first time. What I want to see now is people receiving it. I'm yet to see anybody receiving it. Anybody who has it, you just, I mean, come and tell me I'm not right. Good. Because I wanted to, you know, when you said you don't have, if you recharge with 100 naira.
Yes, 100 naira, yeah.
I mean, that's another issue. But I don't want to go in there. Just, okay, no wahala. Start crediting Nigerians with whatever channel whatever data you have, I want to see Nigerians, I want to hear them that, oh, I've just gotten my own alert, this is what I have. Good, that's what I'm tired of. We will. That's 3 weeks, by Tuesday, so we'll be, that's the 3rd week. We have one week to go. We will, that's what we hear all the time. When are they going to do it? After the whole thing? So let them please start. I don't have issues. It's all they look at. I'm criticizing them all the time. You said you will do it this way. Then let it go round. Let it go round. I have issues. I have issues with those. If you have less than 100 naira, if you have 5,000, I mean, on what criteria? What are you saying?
So you feel that's what criteria enough?
Yeah, it's like Nigerians should at this point benefit.
But they said target was the poorest of the poor. How
do you define poorest of the poor within the confines of your office? What is the definition of the poorest of the poor? Can you just give? I'm yet to see a definition. How did you arrive?
But if we look at it in the fact that probably there are limited resources, and then you have to prioritize on people you give social welfare to. Don't you see that as, okay, let's say if you have 10,000 naira compared with someone who has just 2,000 naira in the account. Don't you see that?
As I said initially, I said, okay, let them start now, no problem. So let them start giving this out. Let them start, and we should have all this drama of we will. Can we just start and let's see?
The effect.
Give it to let's see how it's going to go. Let us know the social the social register you're going to use. How did you generate it? How did you go about it? I mean, because I was watching a TV, a particular channel the other day, and they were asking one of the officers at the social, what's the name, the national cash transfer, I can't remember the full, and he was saying, no, each community, they have a register. And the uncle was asking, what kind of register are you referring to? He couldn't give him a cogent answer. So that's the confusion I'm talking about. That if you want to, any reporter who wants to verify should go to those communities and ask.
You don't even need to go there.
This is Nigeria, where we play politics. If it is not people who are, a certain political, for instance, a state that is governed by a party A cannot give these things to party B. We know. Let us not pretend.
Yes.
How do you generate? These are the data they are relying on. It's simple. They was okay. Go to what this. We know what happened in some states when this issue of start giving. They give it to. I mean, it's not. That is not how it's going to be. They should just. Can we just leave politics for once and do the needful? We allow politics to drive the way we grow this country, and it has never helped us, and it's not helping. Look at the way it's going right now. There are models other parts of the world are using. Can we just use it for once? Put party aside. Today now the chief of staff just died, and I'm not seeing this one say we belong to this party. Can we just for once put the interest of this country first? Get this thing sorted, because right now it has no respect for age, status, religion, whatever. It's coming for you. So can we just sit down for once, for the future of this country and generation next, and do it the way it should be done?
Okay, I like the angle that Tony is coming from, because I think most Nigerians are also coming from, because even right from the first phase of the lockdown, we had lots of people donating money and all that. And I also went on the streets and I found out that a lot of people were still complaining that they're not getting palliatives, they're not getting relief materials. And now there are allegations. You talked about party affiliation, you know who and who does not know who. Now we're having talks about council chairman, local government chairman, even siphoning
the stimulus package.
Siphoning the relief materials. Now, is that not a big issue here?
Let me just say this. First of all, I agree with Mr. Amaji, 100%. I followed my local government. Even I interviewed the councillor in Lagos here. He confided in me that he was only giving 250 of those stimulus package. And that the local government chairman...
How many was he supposed to be given before?
For 6,000 house
in a local government.
Okay, for 6,000 households in a local government, he was only given 250.
Yes, I don't want to disclose that area. In a 6,000 household, you are giving a 250 palliative package. How do you expect that councillor to distribute? I saw the councillor with a policeman, the police are trying to, secure him. He now saw me. Mr. Shegun, this is for you. I said, no. Go and give those that needs it. But first, how many, he said when it's true, he was going to, let me know, that's why people are rushing. I just hold it. I said, okay. When he came back, he gave all the details that he can't talk in their meeting, I can tell you that is one area Lagos State government must look at critically. The people are hungry. Forget what you see from outside. There's a report I did on hunger versus this palliative restriction order. What the Nigerian people say. What the Nigerian people say is simply that I sampled the opinion, even from Parkview. Somebody told me that a big man, I will not mention his name, said he has about 50 bank accounts here that is expected of him to pay 5,000, 10,000 from his account. And that where do I expect him to get all those money back? But what he has in his account is not adding up, it's reducing, and there is lockdown. There's no activities that can even make money come into his pocket. I went to Ogba to interview 2 people. They told me, average middle income earners, they told me they need palliative. I went to the poor, which as an environmental person, I know where we can describe as the poor. Those, their social, economic is alone to tell you their status. Yes. So I went there, they told us, even the package is not reaching them. Now, the last interview of Mr. Governor Sanwo-Olu, he said that they were looking at, getting different locations to start cooking for the people. I felt so bad. His Excellency should not look at that.
Once in a day.
Once in a day. It should not. The people, if we can have a 2,000 naira for these people for that week,
it's better than general cooking.
It's better than general
because we're trying to have social distance now. Now you're going to bring more people to the same place.
There's nowhere physical distance we are talking about and all this. There's nowhere you are not going to encourage that. That's number one. Then there is something Mr. Waji said, and somebody wrote on Facebook that if federal government can locate an interior area to get NEPA paper, to those people to pay their NEPA bills. They know how to go about it if they want to use a best practice methodical approach. They know how to get to the poorest of the poor and give the money to them. Look at the way they did the Minister of Humanitarian Affairs, an urban and regional planning experts who nothing was taught nothing other than rural planning, who knows how you can get to the rich through different techniques in methodology. She's not doing that. She just went to one place in Gwagwadada, and the next thing we had is in 2 days they said they have expended about 3 billion. And you are there, a minister of the Federal Republic of Nigeria, why are you going, doing things,
physical cash.
Physical cash? Are we not? Is there no different methodical approach? Somebody sent one video from Facebook, and that man said all he did was that he went online, email, wrote his name, gave them the condition, gave his location, where he is, why does he, they asked him question, why does he need palliative? He wrote it, and they said, okay, we are agreed, give us your location and everything. They came there quietly and gave him all food items in US or UK. So we are very good at borrowing a concept. That concept will remove what is not of interest to us, but the one that is of interest. Go and check from history. If you look at the land use issue in Lagos, it's a good idea, but when you ask, this land use that you are using is borrowed from UK. But the methodical approach is, after getting the money from the people, they will reflect, they will tell us this is how much I've gotten, and this, what do you people want from the community? Tell us, how do we spend this money? We'll go to a location in Paja there. They will collect other land use. The road is poor, the infrastructure, the drainage is nothing. But Nigerian government, they know how to collect money, but they don't know how to give when there's a need for it. So that has been the challenges. But it's not a challenge. They know, there are experts in this government that know, but because they always want to be economical with the truth, on this aspect I will not be part of them. Because they are always wanting to be economical with the truth. They want to jeopardize everything because of the corrupt rigid process, so that they can gain from it. Muhammad Buhari should know. They will come and be telling him all sorts of stories. Many of them. Look at that humanitarian minister. He has BSc in urban and regional planning. I studied urban and regional planning in my background. If you give an expert, urban planning expert, to give methodical approach on how to give this money, they know how to give the low, middle, and high income. They know how to separate them. There was a time they did population census. You can see the data illustration they use to know where and how, where are those that are needs that must be counted. They know the approaches, but they will not, because of the corrupt review process, for it, to be of advantage to them, all those corrupt people. And now you want us to keep quiet and be looking. People are suffering. Look at them. A lot of people are swearing, shouting. People are calling their loved one outside country to send money to this country.
And even those who are outside the country to affect
you're
not filing.
You are bringing lockdown. The concept of lockdown all over the world is accepted. Ask me what is involved in advanced country about this lockdown. Their palliative method is one of the best in the world. Stimulus packages.
They don't have.
So that is where I am totally different from them. So you can look at this the lockdown issue, then in addition to the stimulus package. So not that you government you come and pick the lockdown issue
and then leave the stimulus package aside.
And forget
because that's what's going to make people stay in the lockdown. Exactly. So let's quickly hear from you.
That's where they are getting it wrong at this moment. Good. If you give people stimulus package, as in real package, not one derrick of rice and a tin of tomato, and then you are insulting them, no matter the level. You're saying stay home for, so it means we are not going to work. We're going to stay indoors. What are we going to eat? Because at the end of the day, people will come out. They will look for something to eat. So how do you encourage them? Do it. Just like they pick a part that suits them, and leave that part that suits the majority, the masses.
Okay.
In Canada, for instance, it's the stimulus package in cash. Most of it is in cash. 2,000 Canadian dollars. In America, $8,200, and it's not per household. The people at the lower level, $500. I got a confirmation.
All right.
Yeah, somebody called even yesterday too. So that is the issue. If we want to see, if you are serious, if the government, this has shown that they don't really care about it. It's only election time, and that's why you see some of them going to label their name, their pictures on most of these
stimulus packages.
Yes.
They put their pictures.
Yeah, they put their pictures and their name as if tomorrow is election.
All right.
That's all what they're after.
Okay, Tony, of course, we've talked about the willpower, and there were also fear and concerns that when people are hungry, they say a hungry man is an angry man.
Yes.
It would lead to violence, and we've seen that in this week we have had increased level of violence. People are not safe anymore. In fact, people are now taking it upon themselves to take care of themselves. I know that in the streets of Lagos within this week we saw bonfires, gunshots, and it's quite scary, because even the people, the so-called vigilantes that are even protecting them, when I saw some of them, I was beginning to wonder the difference, and no apologies to anybody, the difference between even the cultists that are attacking and even the people that are even protecting them, because they were even still harassing us inside the buses. So it's still a major issue there. Now we'll come to you now, Shego Ariyo.
Yes.
We are not having insecurity looming.
Let me first of all correct you on that. I would base on that I would a little bit differ from me, because I write report on security a lot, and I know what exactly is happening. Now, let me use my location as an example. Some people call themselves, 1 million boys are coming, everybody should go out, come down, 1 million boys. I just waited, I know I have their numbers, I have their numbers. But they were now calling, hey, journalists, I said, we must see what that we are seeing that wants to kill us before we can begin to see how to defend ourselves, then call those security concerns.
But there were actually attacks from people.
Hold on, from my location, Ipaja, yes, it happened. But what I discover from my location, Ipaja, there, is that there are raising false alarm. Yes, it happens at a sketchy area. But majority of what happened in Ipaja there is that they are raising false alarm. But eventually, we at Aboru along Abule Egba side, we had. I went there. I saw that there's a cult clash. That is Aboru, and they fought themselves and they killed one person there. I saw the dead. I saw it. I saw the presence of police. I called the area commander. I saw that at 3 a.m. the area commander, ACP Adepoju, was there. at 3 a.m. Are you getting my point? So I said, this is exactly how you should be doing the job.
Okay, Sheikh,
so
now I understand that. Sorry, I'll come in there.
Hold on, in Yanokwaja there, I did not see any. But Aboru, it's a court clash between two court members. So eventually, some people are now shouting, bringing knives. You know, I know what is happening within them there. So majority of them is because of hunger. I can assure you.
I like the fact that you singled out your own area. Now they say there is no smoke without fire.
Yes.
And you mentioned that fine, there were also skeletal issues. And people were also complaining. Now let's look at generally. Let's not just look at Yanokwaja.
Yes.
There are other areas too. I've seen pictures, people complaining. In fact, some of my colleagues
I went further to follow Richard Akinola, this renowned journalist. He is my friend on Facebook, Mr. Richard Akinola. He wrote, and I quote, I said, yes, the police have brought a press release that all they've seen is so far raising false alarm. If you have anything that is contrary, let us know. He has a large followers on Facebook. I followed Richard Akinola. I followed 300 comments there.
Can I comment now?
Okay,
I didn't see all.
Let's
so
hear from
that's for me. I have not seen any.
Okay,
see, please. The issue is this. It happened to me from before now. My car was vandalized before this issue started, and I made a complaint to the police in Lagos here. He followed up. In fact, when it was happening, I was awake and I had to call the police hotline. It was after like 20 minutes after when they left. That was when they came, and the DP of the division came. He came after when they left, and that was how the matter died. And I said, I'm going to follow up this matter. And I got to the station the next morning. He wasn't around. See, when the issue of crime is in the, let's not be sentimental about it. Let's put it away. I don't care if I know the commissioner of police or the DPO or the area commander. The issue here is that it has gone beyond the police. I live in Lagos here, and yesterday there was a patrol around my area for a long time, for like 1 hour. They were patrolling, giving the impression that there's something going to happen. And around 2 a.m., I saw community vigilante with cutlass and all going around. And this one I heard they touched some areas. It's happening. People cannot just make. I watched the DIG Zone 2 on channels the other day, and I was saying nothing like that. How dare you say that? How can you say that? So people just wake up and say that, please, if they cannot police the nation, they should give up. It's simple as that. People are crying, people don't sleep. Then how do you explain the situation where people, we jeopardize their sleep and wake up in the night and stay on the streets?
Why would they stay on the streets for no reason?
If it is a lie, it's not all the time. The police PRO debunk every rumor, so far everything they call rumor. Most of these things are true. If you're not policing, just admit it. I've never seen police say, okay, it's true. We didn't do that, we didn't do well. We're going to do it. You must still deny it. Because you're wearing a uniform doesn't make it better than I. I'm telling you there's a problem, you're telling me nothing like that.
Do we see, okay, now you're saying that there's an issue of insecurity now, and you're saying that if they're not able to handle it.
Okay, now.
Do you feel that we should involve the military?
Okay, now the issue is, okay, we have to follow it up at that point. So the DP was saying, okay, they cannot patrol. They have just one vehicle, okay, but they are reaching out to people who can donate within division. That is where they have a problem. They have a problem of funding. Right now in Lagos State, if you check out, it's Rapid Response Squad that is doing most of police duties. The regular police are just relying on police being funded by Lagos State government. Take out KYARI'S, and we don't have a police in Lagos. Most times the CIG call Lagos and say, we need some number of men, and they take them out of Lagos. So that's why I see some pinpoints in Lagos most times. You see KYARI'S pinpoint, after a while you don't see them again. Because they've moved the men who man this place, I'm telling you from authoritative source. You don't see them anymore. So they have issue of manpower, and they have the issue of vehicle funding most times. But they have a challenge. That is what I want to hear the police say, rather than denying. This thing is happening every day. It's happening. I know with this lockdown on just before on my way here, some hoodlums covered. I was ready. They said I won't move. So I will not announce it. That everybody must drop. I've never seen it. There's tension, and if you don't say it, how do they know?
Anyway.
So in other words, would you advocate for the military so that we can have...
It's fine.
Because we also need... Because now we know that sometimes we see them most times on the express, but in their communities, we don't see policemen guarding the areas.
Because they have issues of... They don't have manpower. And That is what I expect the police to say, so that the federal government can hear them. They don't have how many policemen, less than 500,000 manning the country of a population of more than 200 million people. How do they go about it? So we know we're on the police already. So put it forward. That's what you have to be saying all the time. Don't say it doesn't happen. A crime happened around me and I came to report to you as a citizen. It doesn't happen. I'm telling you it happened.
Now let me.
And they don't follow up. At this point, this is when OP Mesa needs to come back. I don't see them like before anymore.
Let me say this.
OP Mesa needs, Lagos state governments need at this point to get the military involved in this.
Can we even bring up Amotekun into
I don't care. Is that okay?
I think you know that Amotekun security issue. Will we say that since the police security agencies are not, we are understaffed now, should we involve them?
Now let me say this. I will disagree on this issue, because on particularly here on this bringing in OP Mesa military, from experience we know how soldiers, go about, bringing a lot of fundamental human rights issues on every human being day. I
don't think we should sing
when even the police can do. Let us not remember the laws that we are talking about on restriction order. Please, we need to read that law through. It is more of civil. The law is more of civil, not.
And once the citizens disobey, what happens?
Those that are using mobile courts to convict them, I think they are doing their job. If you are found guilty, so we should see how police would engage these people more.
They say they are not seeing police. They say police again. Which police are you referring to, Ario?
But he's complaining about the police being.
I am talking from my area specifically. He is talking about his area, but on a general level, I walked around as a judge.
You have been making a
I have not seen anything that has something to. I know about Agege. Our boys. I know that there are our boys. There is 1 million boys, but I can tell you largely, many of what you are hearing, as a son of the soil, many of what you are hearing is more of raising false alarm.
I disagree.
That is your opinion. Because I've seen lots of people say that if I see anything, in the middle of the night, people are complaining that they are not secure. I think the bane of the matter there
and then ask me
security agencies.
What came out from it?
I think the bane of the issue here is that security agencies need to step up on their duty to protect Nigeria, so that we do not have anarchy. Please, and of course, let everybody be responsible for themselves. If you see yourself having symptoms of coronavirus, please do not treat yourself. Do not just please self-isolate and call the designated numbers. NCDC, please give the confirmed people, let them know how you are feeling, so that you do not also infect others. Keep yourself safe to keep others safe, because this thing goes around. As we said, it knows no tribe, it knows no race, it knows anyone. It can affect anybody. Please keep yourself safe. Have a good personal hygiene. Wash your hands with hand sanitizers. Please let us just keep that habit up. And even for the lockdown, I know it is hard to stay indoors. Try and keep yourself busy. Read a book, learn a skill, do something online instead of browsing and doing other things. Browse something that will affect your life positively during this lockdown. Of course, we do hope that we pass this situation by God's grace. Of course, that's as much you can take on today's edition of Editors Forum. Thank you very much, Tony Nwaje, Olusegun Ario, and of course to our beloved audience, thank you for being a part of Editors Forum. Do join us same time next week, God's willing, for another edition of Editors Forum. I am Rita Omodia. God bless Nigeria.